Jake got a letter in the mail in January 2026. It was from his health insurance company. He almost threw it away thinking it was junk mail, but something made him open it, and what he read inside stopped him cold. His monthly premium was going from $340 to $680. Double overnight. Same plan, same coverage, same insurance company, just double the price. Jake works full time. He is not rich. He is not poor. He is exactly the kind of person the American healthcare system was supposed to protect. And in January 2026, that system failed him completely. Jake is not alone. 20 million Americans received similar letters. 20 million people woke up in 2026 to find their health insurance had become unaffordable overnight, and most of them had no idea why. Today, I'm going to tell you exactly why, who is responsible, how deep this problem actually goes, and what you can do right now if you are one of the 20 million. Stay with me, because this one affects every single American, whether you got that letter or not. Let us start with what actually happened, because to understand why 20 million Americans lost affordable health insurance, you need to understand one law, the Affordable Care Act. Most people know it as Obamacare. When it was passed in 2010, it did something very important. It created subsidies, government payments that helped ordinary Americans afford health insurance. If you earned between a certain income level, the government would pay part of your monthly premium for you, and for millions of Americans, those subsidies made the difference between having insurance and having nothing. Then COVID happened, and the government expanded those subsidies even further. Under the American Rescue Plan of 2021, subsidies became available to more Americans than ever before. Premiums dropped, enrollment surged, and for the first time in years, health insurance felt almost affordable for ordinary working Americans. 21 million people signed up through the ACA marketplace in 2025, a record high. People were finally covered, finally protected, finally able to go to a doctor without financial terror. And then Congress let it expire. That is the part nobody is explaining clearly enough. Those expanded subsidies had an expiration date. They needed congressional approval to continue. And in late 2025, Congress failed to extend them. No dramatic vote, no big news story, just a quiet expiration. And 20 million Americans woke up in January 2026 to find that the financial support keeping their insurance affordable was simply gone, and their premiums doubled overnight. Now let us talk about the real numbers, because this is worse than most people realize. The average ACA premium increase for people who lost subsidies in 2026 was between 80 and 120%. Not a small adjustment, not a minor tweak, double. For some Americans, premiums went even higher. A 45-year-old in a high-cost state who was paying $400 a month is now paying $900 a month. That is $10,800 per year, just for insurance, before any deductibles, before any copays, before any actual medical care. And here's what makes this even more devastating. The deductibles did not go down. The average deductible on an ACA plan right now is around $5,000, which means you are paying $10,000 a year in premiums and then another $5,000 before your insurance even starts covering anything. That is $15,000 out of pocket before your insurance company pays a single cent, and the median household income in America is around $78,000, which means the average American family is spending nearly 20% of their entire income just to have the option of using healthcare. That is not insurance. That is a punishment. Now let us talk about what people are actually doing, because 20 million people cannot simply absorb a premium doubling overnight. And the choices they are making are heartbreaking. Some people are dropping their insurance entirely. They are calculating that paying the premium is impossible, and gambling that they will not get sick. And that gamble works right up until it does not. One emergency room visit without insurance, one unexpected diagnosis, one car accident, and you are looking at medical bills that can exceed $100,000. Other people are downgrading to cheaper plans with higher deductibles, narrower networks, fewer covered services. They are paying less per month, but getting dramatically less protection. And many of them will not discover how little their new plan covers until they actually need it. And then there are the people who are making impossible choices, skipping prescriptions because they can no longer afford them, avoiding doctor visits because the copay is too high, ignoring symptoms and hoping they go away, because the alternative is a medical bill they cannot pay. This is not a statistic. This is happening in every city, every town, every neighborhood in America right now. Now let us talk about who this is actually hitting the hardest, because it is not who most people think. Wealthy Americans are fine. They either get insurance through large employers or they can simply afford the higher premiums. Poor Americans who qualify for Medicaid are also protected. Their coverage did not change. The people getting destroyed are the ones in the middle, the self-employed, the gig workers, the small business owners, the part-time workers, the early retirees between 60 and 65 who are too young for Medicare. These are the people who depended on ACA subsidies the most, and these are the people who got hit the hardest. Think about Jake again. He is self-employed, running a small business. He does not get employer-sponsored insurance. He was buying his own coverage through the ACA marketplace, and his subsidies made that coverage manageable. Now those subsidies are gone, and Jake is faced with a choice between paying $900 a month for insurance or going without coverage entirely and running his small business with zero financial protection against medical catastrophe. Think about the early retiree who left their job at 62. They planned their retirement finances around ACA subsidy amounts. They built their entire retirement budget around a subsidy that just disappeared. And now, at 62, too old to easily return to the workforce, too young for Medicare, they are trapped in a coverage gap that could bankrupt them with a single health event. These are not lazy people. These are not irresponsible people. These are Americans who planned carefully, worked hard, and got blindsided by a policy decision they had no control over. Now, let us talk about why this happened and who is responsible, because the answer is more complicated than most people want to admit. The subsidies expired because Congress did not act, and Congress did not act because there was no political consensus to extend them. Some lawmakers argued the expanded subsidies were too expensive, that they added too much to the federal deficit. Others argued that they were essential, that cutting them would devastate millions of Americans. And in the end, the deadline passed, and 20 million Americans paid the price for that political failure. But here's the deeper issue. America is the only wealthy, developed nation on earth where your ability to afford healthcare depends on which state you live in, what job you have, what your income is, and whether Congress remembered to extend a subsidy. Every other wealthy country has figured out how to make sure its citizens can see a doctor without financial ruin. America is still arguing about whether people deserve that basic protection. And while that argument continues, 20 million people are making impossible choices. Now, here's what you can actually do. Because if you are one of the 20 million, or you are worried about your coverage, there are real moves you can make right now. Number 1, go back to the marketplace immediately, even without the enhanced subsidies. You may still qualify for some level of subsidy based on your income. Many Americans who dropped their plans or did not re-enroll assumed they no longer qualified for any help. That is not always true. Go to healthcare.gov right now and run the numbers before assuming you are on your own. Number 2, check if you qualify for Medicaid. In states that expanded Medicaid, the income threshold is higher than most people realize. If your income dropped at all in 2025 or 2026, you may now qualify for Medicaid coverage that costs you nothing. Do not assume you make too much without checking first. Number 3, look at health sharing ministries carefully. These are not traditional insurance, but they are a lower cost alternative that some Americans are turning to. Understand exactly what they cover and what they do not before enrolling. They have significant gaps, but for healthy people with low medical needs, they can bridge a coverage gap. Number 4, if you are self-employed like Jake, maximize your health insurance deduction. The premiums you pay for your own health insurance are fully tax deductible if you are self-employed. That does not make the premiums affordable, but it does reduce the real after-tax cost. Make sure your accountant knows every dollar you are paying. Number 5, build your medical emergency fund now. Even if you have insurance, the deductibles are so high that a serious medical event will cost you thousands out of pocket. Having $3,000 to $5,000 set aside specifically for medical costs is your financial shield against the gap between what your insurance covers and what you actually owe. Here is the bottom line. 20 million Americans did not lose their health insurance because they made bad decisions. They lost it because a subsidy expired, because Congress failed to act, because a political system that was supposed to protect them looked the other way, and now they are paying double, or going without coverage entirely, and hoping they do not get sick. Jake is still figuring out what to do. He is running the numbers every week, trying to find a way to afford coverage while keeping his business alive. In the richest country in the history of the world, 20 million people like Jake are one diagnosis away from financial destruction. Not because of anything they did wrong, but because of a system that keeps failing the people who need it most. You now understand exactly what happened. You understand who it hit. You understand why, and you know what to do about it. You have been decoded. If this video explains something that nobody else made clear for you, subscribe to Money Decoder 3004, because every single week, we decode the financial forces that are quietly destroying ordinary Americans. Simply, honestly, and clearly. Drop a comment below and tell me, are you one of the 20 million? Or do you know someone who is? Tell me below. I read every single comment, and I will see you in the next decode.